It is now possible to check the health status of your prostate and bladder from the comfort of your own home. What's needed to do this? Just your smartphone and a toilet. The Prostate Health Podcast has been dedicated to keeping our listeners up to speed on the latest technology for prostate health. And for our 100th episode, we have a very special guest today, and we'll be getting you up to speed on what you need to know about a groundbreaking new mobile app called ProudP, which is proving to be a valuable tool for men as a personal prostate health monitor, but also for urologists, providing valuable Uroflow data without the need for expensive and cumbersome equipment. So stay tuned. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is a question, and this podcast will provide the answers. On the podcast, we'll be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pohlman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. We're very excited to be partnering with Soundable Health to bring you our milestone 100th episode on the Prostate Health Podcast. Joining us today on the podcast is Dr. Catherine Song, who is founder and CEO of Soundable Health, a digital health startup that develops digital audible biomarkers. Prior to the company, she served as Chief Operating Officer at UNO, a Boston Seoul-based digital health startup, and as a Digital Health Advisory Committee member in the Ministry of Food and Drug Safety for 2 years. She also spent over a decade at Lam Research Corporation, a NASDAQ company and global leader in semiconductor equipment, as a Senior Strategic Operations Manager, and took various technology and product leadership roles in LG Electronics in the field of high technology and consumer electronics. Her education includes a Ph.D. in electrical and electronics engineering from Korea Advanced Institute of Science and Technology. Dr. Song is a true innovator, and I'm excited to have her on the show today to educate our listeners on this groundbreaking new mobile app, ProudP. Dr. Song, welcome to the Prostate Health Podcast.
Thank you so much. Yeah, hello from San Francisco Bay Area, and congratulations for the 100th episode. It's my great privilege to be here today.
Well, it's certainly an honor to have you on for our 100th episode, and definitely a milestone, and I think such a great way to celebrate it to have you on today. Well, personal health monitors such as blood pressure monitors and glucose monitors are essential tools that are vital as we manage chronic conditions. However, for BPH, what's been missing is an accurate, at-home, easy-to-use personal prostate health monitor until now with ProudP. Dr. Song, what is ProudP?
Oh, yes. ProudP is an FDA Class 2 uroflowmeter. It's revolutionizing uroflow tests by allowing patients to conduct tests conveniently at home. It's a smartphone app, and it simplifies the process by analyzing urine sounds to provide accurate uroflowmetry results. It captures and interprets sound and urine as it flows into the toilet bowl during bathroom visits. So this technology eliminates the need for additional equipment. All you need is just your smartphone and the ProudP app. Simply download the app on the App Store or Google Play and carry your phone for your nature call. And you let ProudP and its AI do the rest of the thing. Then it converts immediately urine sounds into office uroflowmetry metrics like voided volume, peak flow rate, average flow rate, voiding and flow time, and the flow curve over time per se as well. And additionally, ProudP offers a range of supplementary features to enhance patient care. These include the bladder diary and multiple score systems such as AUA symptom index, IPSS, and some sexual function assessments like IIEF and MSHQ.
Well, so traditionally, to be able to capture this valuable data, it was required for men to void into awkward equipment at the urologist's office. And not only is this not, in my opinion, representative of the day-to-day normal urinary pattern, it isn't uncomfortable for men to do this at the clinic, but also for us as urologists, it really hasn't fit well into the normal clinic workflow. I find this new technology fascinating, and can you explain a little bit more about how does it work?
Yes, we will discuss about the limitation of the current office uroflowmetry in the later part of the show. But sure. Let me give you some scientific and engineering pieces behind it. So let's first visualize the journey of the urine exiting our body. When the brain signals the bladder to empty, it triggers contractions, facilitating urine passage, right? And this urine moves through the bladder neck and into the urethra before exiting. The urethra is elastic and flexible tube. Its shapes, combined with the squeezing force of the bladder, results in a non-linear turbulent flow of urine stream. So additionally, the potential energy from the height difference between the body and the toilet water below there adds to this turbulence, generating various sound events upon contact into the water. So this journey illustrates how factors like bladder contraction strength, bladder neck obstruction, and urethral condition influence the energy of the urine stream and subsequent dozen of sound events. So our AI detect and analyze these subtle changes in sound and acoustic signals, enabling precise measurement of flow speed and amount. So while one would assume that the longer urinary sound indicates a longer boiling time or the flow time, that's easy, right? But the reality is more intricate for the other metrics or blood curves. So various sound events and sound characteristics, acoustic signals, including loudness of the sounds, or the high or low pitch, timbre of the sounds, or room acoustics like ambience, and some energy distribution over time and frequency bands, all contribute to the complexity of the prediction model of AI. So these factors are managed through fluid dynamics, audio signal processing, and AI, all the engineering science things. So I will avoid diving into too much engineering specifics to keep focused on understanding the very basic principle without overwhelming listeners.
Well, I feel it's always interesting to hear the story behind how these new innovative technologies are really invented. And I know our listeners would love to hear, how did ProudP come to fruition?
It's a friend of mine, the group of urologists, urogyn, nephrologists, engineers especially equipped in some mechanical engineering, electrical engineering, computer science. But just during our daily chit-chat, once we realized that there's no such a digital health patient data, the urology. So there are so many the patients, more than 30 million BPH, and another 30-40 million has been continence. But there's no such a thing in urology. Then we started to develop the questions. So what should be the essential measures to track at home? And what should be the blood pressure or the blood sugar you mentioned in the beginning of the show for BPH and incontinence? So there was IPSS or Uroflow and bladder diary. And personally, I've been with my mom suffering from interstitial cystitis and refractory urologic symptoms for more than 30 years. So I have understanding about the patient lives and the caregivers' lives. So all those were the seeds of the product and the business. And all those family and friends are medical advisors, investors, and the co-founders back the company today. Yeah, that's it.
Well, very interesting, and thanks for sharing that with us. And I'm sure a lot of our listeners would like to know, with this new technology, can you comment a little bit about the accuracy of the Uroflow data with ProudP?
Yeah, there was the very critical part in the beginning of this journey of the ProudP, because the measure accurately from sounds, not a weight scale or the spinning disc, with how to persuade and make the urologists and community convinced of the accuracy was a critical part of this new technology. So we are dedicated to delivering medical device technology as a medical device vendor of the highest quality. So from the start, our goal has to be achieve exceptional level of accuracy to earn the trust of the urology community with this new technology. So we started from a quick and dirty engineering prototype at the very beginning, but soon through rigorous development iterations, we finally successfully refined our technology to achieve the clinical grade accuracy and reliability. And our commitment to accuracy is reflected in our outstanding performance with an accuracy rating exceeding 97% in well-controlled office environment. And this achievement is supported by over a number of clinical validation studies and over 30 abstract and peer-reviewed journal papers, which involve a direct comparison with a high precision gold standard uroflow penetrative devices. And we also recreated for the real-life bathroom scenarios and real patient behavior during urination and during recording, complete with water-filled containers and recorded urine sounds. We've collected more than 400,000 Uroflow test results conducted by real individual health consumers and real urology patients. Through those extensive testing and validation, multiple iterations, we analyze various factors that impact accuracy, including the external noises, room acoustics, and some patient behaviors during urination measurement, and so on. So by refining our algorithms to accommodate all these variables, we consistently deliver reliable and trustworthy results.
Well, when it comes to, especially for our urologist listeners, what implications would you say this will have implementing this technology in the BPH or enlarged prostate care pathway in the urology space?
Yeah, so let me share the couple of points here. First, the easiest thing was the body limited efficacy of office uroflow test. So we believe that ProudP brings a significant shift to urology practice by providing doctors with home uroflow data, in addition to the office uroflowmetry with results, and IPSS with a home-based patient-reported IPSS. Well, all those were previously not accessible or too expensive to capture the enough amount. Consider this scenario. During office uroflow test, patients may struggle to urinate on command at that moment, resulting in the voided volumes of the 150 cc or less. Well, that's quite frequently happen, right? But rendering the data non-interpretable according to the AUA uroflowmetry guidelines. With alternatively, they might need to wait for a couple of hours in a waiting room to obtain a full bladder according to the protocol. It disrupts the clinical, the schedules, and private schedules a lot. And moreover, the patient may already most of the times experience urinary retention already by the time of their office visit. So that makes treatment uroflow results unattainable. So ProudP addresses all these challenges by enabling patients to measure uroflow at the comfort of their home. They can get ready before they see urologists. So this approach offers insight into real urinary patterns reflected daily life, including bacteria or the frequency, the order, or the overall course of treatment. So with ProudP, doctors gain access to invaluable patient data, enhancing diagnostic confidence and treatment planning as well. So these examples illustrate how ProudP transforming urology practices daily, enriching patient care and clinical decision-making. However, our vision extends beyond this immediate application and not just coping with this limitation of the office equipment. So that's the second point. So it's about getting real-world data and evidence for a comprehensive picture of symptoms and progress of the diseases. So many urologists emphasize that the IPSS alone, it's a very subjective the symptom report, right? May not provide a comprehensive understanding of the lower urinary tract symptoms less BPH. So key opinion leaders in Latvia advocate for integrating IPSS, the subjective report by patients, with uroflow data, the objective one, over time in a longitudinal manner with over the course of treatment to achieve a holistic, more full picture of the symptoms and progress, ideally spanning the entire BPH episode if possible. So this combined approach, subjective, objective, and the longitudinal monitoring over the course of episode approaches proves invaluable, particularly when communicating with treatment efficacy to patients. So objective uroflow data offers clarity and assurance, especially when patients may sometimes struggle to discern noticeable for the post-treatment differences, right? In their cases, objective result, the chart and the numbers, it will really help patients to convince about their treatment. See, it really works. So through ProudP, we've observed remarkable outcomes derived from the real-world data across various second-line therapies, medications, and third-line surgeries and surgical procedures, for the BPH. So these insights provide enhanced clarity and efficacy in treatment evaluation and empowering clinicians and patients alike. And also for the clinical investigators like you, Dr. Pohlman, who are developing new therapies and validating it and need the real-world outcome measures and evidences to prove its effectiveness. So the third point would be for BPH awareness, population screening, and the risk assessment possibility. So as urology care evolves, ProudP has the potential to complement and enhance the patient journey alongside the urology specialist and also for the primary care. But we all know that 60-70% of the BPH patients first see the primary care, right? Then they can work to the urology specialty clinics by referral. So with Uroflow avoiding diarrhea and IPSS scores readily accessible via ProudP with application all at once, patients and the GPs at primary care now have the access to previously unavailable data. So this accessibility enables early detection of urinary symptoms. Even before patients with PCPs, they can get ready to see that with data. And we know that many men over 50 may not much familiar with the LUTS/BPH, potentially leading to delayed treatment and many complications, and sometimes fail to preserve kidney and bladder functions, right? The ProudP offers a discrete and a very user-friendly platform to provide objective information. It can raise awareness and facilitate early intervention. So true strength of ProudP lies in its 100% software-based solutions. It is a SaaS-based application, eliminating all the needs for the additional hardware or the cumbersome equipment. And it enables all things instantly with a scalable. So, for example, let's assume that the one health system can distribute this digital tool for its 10,000 eligible members immediately via MyChart application or the text messages. Then the 10,000 members can do the immediate Uroflow IPSS and other evaluation once, and the clinical investigator health systems collect all the data at once. Then they can do some population risk assessment and screening, and they do the treatment or the guides for their members. So we believe that the ProudP opens up a myriad of possibility beyond those 3 points for transforming and optimizing urology care delivery and improving patient outcomes and the quality of life.
Well, it's exciting. I think this is truly a game-changing technology, not only for patients, but as a personal prostate and bladder health monitor, but also for urologists in their practice. And like, as you mentioned, even primary care providers and health systems. So, I know our listeners are going to want to know, where can they go to get this ProudP app?
Yeah. For the general health consumers or patients, it is easy. Just go to App Store, Google Play Store on your smartphone and download the app. Yeah, the ProudP, ProudP. Yeah. Well, that's it. You just head to the App Store and Google Play and download the application. And for the clinicians and investigators, the Pohlman, it's simple as well. Just visit our website, www.proudp.com, and drop us a line with your name, clinic name, and email. Then we will immediately follow you to begin the process of onboarding of the ProudP application and the clinical dashboard for your clinical setup. So once onboarded, doctors will gain access to the web-based dashboard through the browser and all the data your patient would measure at their home immediately.
Well, it sounds pretty straightforward, and I think it's something that we all can take advantage of. So thank you for that. And well, Dr. Song, any final thoughts today for our listeners?
Oh, sure. In closing, ProudP stands as a beacon for timely, informed decision-making support in urology. So it serves as a steadfast companion throughout the care journey, offering support and clarity amidst the trained decisions of the course of the care. Furthermore, ProudP lends invaluable support to the clinical development and the therapies, providing objective outcome measures to assess efficacy of procedure. So gone are the days of guesswork or just hit or miss approaches to important decisions. With ProudP, clinicians can choose between vague descriptions or precise measurements, empowering them to make decisions with confidence. And by providing combination of subjective and objective measures in a longitudinal manner, ProudP equips clinicians with a comprehensive understanding of symptoms in its progress, enabling them to deliver personalized care tailored to each patient's unique needs. And ProudP stands tall as a number one real-world data and evidence platform in urology, boasting the best and largest data set to my knowledge in our class. So with over 2,000 patient-generated home Uroflow tests conducted a week, 2,000 a week, when equivalently 100,000 annually on the ProudP platform alone. But we know that it's around the 500,000 office Uroflow tests in the States annually. So it's just 20% of the same period of time. So it's clear to see that the transformative potential for optimizing access, delivery, quality of prostate and bladder. So now is the time for data-backed informed decision-making across the entire care pathway. So let's engage patients, GPs, advanced practice providers, and specialists, all alike. So real-world data coupled with this ProudP platform undoubtedly stands as an integral part of this transformative journey towards better care.
Well, Dr. Song, again, I can't thank you enough for joining us today for our 100th episode on the Prostate Health Podcast. Just solid gold. And thank you for educating our listeners on this innovative new technology. And we really do appreciate you taking time to help empower our listeners. Thank you again.
Yeah, thank you, listeners, for having me today. I really enjoyed it. And AUA 2024 and SOBPD is just a week away, right? So I do look forward to connecting with listeners in San Antonio. Meet you all there. Thank you.
Thank you again for listening to the Prostate Health Podcast. For those of you wanting to dive in even deeper, make sure to check out the Prostate Health Academy, which offers comprehensive and easy-to-navigate lessons that I have prepared for you. There's also an active private community forum, and I am there every day providing support, insight, and answering questions. To learn more, just go to www.prostatehealthacademy.com and click on Join Now. Well, that's it for today. We will see you at the next episode.